we actually found things that looked like a parasite. It
Wow.
was moving, it had tentacles. Well, we think it's because there were parasites in the vaccine that were infected into the human body.
People who just didn't want to get the vaccine were like lambasted on the streets. And
One day after the announcement here in Canada, the Prime Minister Justin Trudeau announced it. One day after announcing it, we had billing codes in our office, meaning that the doctors could actually bill for COVID-19. They could bill the government.
people are going to the doctors and they're like, yeah, I just feel a little bit down or whatnot. And the doctors are like, here's a tablet. Why wouldn't just suggest to them, try going out and get some fresh air, try eating some fruit and vegetables, work out, release endorphins, do good things. Because I see them on a podcast and he brought live, white tree branch looking blood clots from people. And it's crazy because these are people who, have had the vaccine and then, they have to get a leg amputated or they're dying.
So we believe that cancer is a parasite infection. And that's why, for example, things like Ivermectin and mebendazole are working so well because it's killing the parasites in the body. The parasites are creating these sacs, which we call tumors, okay?
Hello, everybody, and welcome to another episode of the Let's Get Chattin podcast. As always, I am your host, Josh, and today I have got Svetlana with me. What I want to say is about Svetlana is you were a nurse previously, right? But not she's not your average nurse anymore, let's say. In fact, so you spent 25 years inside the healthcare system, and in 2021, when refusing the COVID-19 vaccine, that cost her everything. I mean, she lost her job, she lost her marriage and custody of her children. But out of that devastation, she became a whistleblower, standing against what she calls the greatest medical scam of our time. She now runs Ezra Healing, which we will get into, which is helping people worldwide recover from vaccine injuries and fight cancer without chemo. This is going to be pretty raw, unfiltered, and probably, I would say, unapologetic. How are you today?
Hi, Josh. It's so great to be here. I'm doing really well. I just actually flew in from Minnesota, US yesterday, back to my hometown of Kelowna, BC, Canada. And I love that we're talking to you and your audience in England. We have a presence in England, and I have a heart for the UK. So this is, I didn't know you were from there. So this really excites me. And I love how we're all just connecting all over the world.
Mm-hmm.
In unity and love and light and healing, and we're just making the world a better place.
Yeah, 100%. I mean, I find that with regards to, especially the podcast anyway, on a little sidetrack, is like, I speak to people from all over the world, and it's like, I'm learning different things and spreading each other's messages. So like people like where I live have heard, like people speak who they would never in their life heard unless they listen to this podcast, which is great. Cool. So what I want to do is like to start and get into it is find out a little bit more about your background first. So the idea is to find out a little bit more about your professional history. And the reason I say that is because there's so many people who go on podcasts and they chat a lot of crap and they don't have the professional history to back it up. And what I want people to understand who are listening to this today is like, this is someone who's been in the industry, knows everything like in and out. So it's not just someone chatting shit, you know?
Yeah, that credibility is really important. And I love
100%.
that you're highlighting this because, for whatever reason, so many people became, self-professed doctors and healthcare providers, in 21 and 20. So, I've been a nurse for 25 years. I trained as a registered nurse. I have my Bachelor of Science in Nursing from the University of British Columbia in Canada. I have worked in all sorts of different nursing, emergency setting, ICU, an educator at the university, primary care, doctor's clinic, correction facilities. So I've every about 3 years, I change sort of the style of nursing I was doing. Public health. I once ran a mass vaccination flu clinic, 15 years ago.
Wow.
So, I've come really full circle in terms of being indoctrinated on the medical mafia education platform, I'm going to call it. And, in 2020, 21, when I started to see the real, crimes against humanity and the corruption, I was able to use all of my knowledge in the last 20 years as a nurse, working with, clients, patients, doctors. I was just able just to put the puzzle together quite quickly,
Yeah.
and we're not adding up. I went to become a nurse to help people and do no harm. That's
Sure. Yeah.
my promise to myself and to the people I serve. So when I was starting to be asked to do harm to my patients, I mean, no way in hell was I ever going to consider that. And we've never been requested of the medical matrix to inflict harm on our patients. But now that I'm understanding more of their model, I've actually been inflicting pain on patients for most of my career. I just thought it was, the right thing, and I was indoctrinated.
Yeah.
So my awakening moment was in 2021 when I was working at a family doctor's clinic, basically working at a doctor level,
Yeah. Yeah.
prescribing, suturing, full on exams. The vaccination campaign was full on. We're about probably 6 months into it, and a young woman in her 30s, she was a physiotherapist. She got 2 jabs to keep her job. Very athletic. Anyway, she came in after her second vaccine, and she literally couldn't walk. And she
Jesus.
proceeded into, a wheelchair, and 6 months later, she was very suicidal because her life is just getting devastated, right? And
Yeah.
her
Yeah.
doctors are not really helping her. They're not really listening to her, though they're, diagnosing her with, say, MS, multiple sclerosis, or a nerve disorder. But, I got to witness these clients being completely ghosted, and
Hmm.
disregarded from their family doctors, and they just wanted to pass the buck. They didn't want to actually get to the root cause of why people were literally coming in not able to move their limbs, not able to move their bodies, having the worst headaches of their life. So, it was at this time when I refused the vaccine that I did get fired. And I said, you know what, we're going to need a new wellness paradigm where
Yeah.
people can come and they can be heard and actually start to heal from vaccine injuries, and actually the entire system of the medical system that actually causes more trauma than healing. So we're going to need to be creative and create something new. um,
100%.
my passion, my goal is to help everybody to understand that they never need another vaccine in their life. They never have needed another vaccine. So if I can help eliminate all vaccines on the planet, that would be, just, really great, for me to see that come into play. And our kids, we're starting to see parents starting to not vaccinate their kids, which is so good. Um, Babies are being birthed at home now more and more. They're not being subjected to, the trauma that a baby, comes into this world. So
Yeah.
I have knowledge on, a lot of different things, and my specialty in the last 5 years has been the COVID-19 bioweapon, the virus, the vaccine injuries, and now this turbo cancer we're seeing. And I consider turbo cancer to be a
Hmm.
vaccine injury.
Yeah, I mean, I everything you said there, especially like I agree with so much. It's like, in fact, before recording, I actually got some stats that I just want to read out for the people listening because it actually like blew my mind. So myocarditis, which is like heart inflammation, isn't it like it, they say it's like 75.9 per million people who had like the mRNA vaccines. Um, Guillain-Barré syndrome, GBS, which this actually touches me not on a personal level as such, but I never heard of this before until about 3 weeks ago. Someone I know actually went to hospital. They had like no feeling in their body, and it was like out of the blue. And it's like all of a sudden they have this GBS, but that's like 1.25 people per million. They're saying get this from vaccine injuries. And then you've got like VITT, which I don't know too much about, but it's 1 per 100,000 doses of AstraZeneca. Anaphylaxis, which is like allergic reactions, 5 per million. And it's all of these stats that are coming out now. And I still think people don't understand this. It's a massive concern for me. I do need to ask my friend actually if she had the vaccines because that's super interesting. I do need to find that out. Um, so when COVID first hit and it was like in the media and all of that, what was your instant reaction to that?
For the first 2 weeks of COVID, I was under the impression that this was a real pandemic,
Yep.
and I played along for a couple weeks, preparing our emergency department and emergency preparedness protocols, and as I was just getting into it, there were just so many things that were coming up that made me just stop in my tracks and say, "This doesn't make sense." My intuition was just off the charts. This isn't making sense. Um, so that was pretty much, 2 weeks of playing along, and then I just went into full on whistleblowing mode, and I just started, em exposing my findings, for example,
Yeah.
and
Yeah.
helping people to understand that there is some major, major moral and ethical dilemmas, and I had a lot of people obviously agree with me, and then I just started leaking information about what I was seeing at the doctor's office on what made COVID-19 a complete scam. They
Hmm.
had, one day after the announcement here in Canada, the Prime Minister Justin Trudeau announced it. One day after announcing it, we had billing codes in our office, meaning that the doctors could actually bill for COVID-19. They could bill the government. So for something that just came on scene that was such a surprise, why
Yeah.
do billing codes in our electronic health records already, right?
Yeah.
They just it's all a money grab. The doctors before COVID-19 were not paid to see a patient if it was just over the phone. Okay, they
Hmm.
had to be
Yep.
in person. But as soon as COVID-19 came, they actually incentivized physicians to start, talking on the phone with their clients, with their patients. So, a lot of like you can't do proper healthcare over the phone. Like
No.
it's
No.
part of it. It's a great tool, but you really need to be able to look at a person, assess the person, touch the person,
Yep.
smell the person. It's all part of doing healthcare properly. And
Yeah.
it broke my heart to see so many people needing a primary care provider and not being able to get one. I mean, we already have long waiting lists. I mean, that just tipped over. And I was married to a family doctor for 20 years, Josh. So I
Okay.
have a lot of the insider view. And these doctors, their colleges basically said, if you talk, bad about the vaccines, you're gonna lose your license. If you prescribe ivermectin, we're gonna take your license away. So they had this gag order on them.
Yep.
Saw the letters come in because I was married to a family doctor at that time. So I was privy to a lot of information and actually, full disclosure, about 5 years prior to 2020, these doctors were getting more and more bonuses in their bank account that would just show up as just, thank you money. And
Yeah.
I thought, "Oh, okay, well, I mean, that's nice, I guess, thanks, but what's your motive here?" And when COVID showed up, they told the doctors to shut up. I was like, "Okay, that's probably why they've been buttering 'em up with all this, money
The
prior."
dangling of the carrot, right?
So it's unfortunate my marriage did dissolve in 2020, to my husband of 20 years, and we could not see eye to eye on this topic, and he continued to pursue the narrative. He thought Fauci was awesome, he thought Bill Gates was awesome, and, here's me, like, wanting just to burn their houses down. So we had a very different, opinion on this, and, so it unfortunately, dissolved our marriage, and, a lot of people the divorce rate really went up during COVID time, which is really sad. The breakup of a family is very it's not healthy, it's sad, but, we've all made the best out of it, and then,
Yeah.
um
I think with regards to the aspect on like the the narrative was pushed so hard that they made people literally it was a bit like the whole like red and blue in America at the minute. Like that was like vaxxers and anti-vaxxers or people who just didn't want to get the vaccine were like lambasted on the streets and the whole not wearing a mask. There was so many times over here you talk about doctors waiting list, the NHS is crumbling. It is on its knees, its last legs. And every doctor's appointment is over the phone. It's crazy. It's nuts.
what does
Um
NHS stand for? Sorry, Josh?
the National Health Service, so it's the free
Okay.
yeah,
Do you
well,
guys have private healthcare
we
in
we do.
yeah?
Yeah, but that's also lambasted. It's absolutely ruined. It's everything. all of our healthcare is on its knees.
So what you're saying is you need a new healthcare system to come in and help people.
Um, Possibly. I mean, our biggest thing at the minute is the there's too many people.
Mm,
There is just too many people. I mean, we let God knows who in all the time and whatnot, and that's a completely different conversation. I'll lose my job for saying any more than that, literally. So I'll leave that there. um, but it's yeah, the NHS it is just on its knees. But with regards to like the vaccine and stuff, there was so many times, or even just COVID in itself. Like to me, it was just a cold. It's a cold. Like you're most people will get over a cold just like you would, you know. But going out not wearing a mask, it was like you walk down the street and people are like shouting at you, and it's like put a mask on, blah blah blah, and I'm like, what the hell is going like? What is going on? It turned people on their heads. It was crazy,
mhm.
and it's well. You mentioned about the bonuses and stuff before. That would suggest it was definitely something that was planned and that ready, waiting. You know.
Oh, I mean, it's the strategy that's gone involved, this was is absolutely off the charts. It's really impressive strategic planning, and I've often said I would love to sit or be a fly on the wall to see how they've orchestrated this because it's
Hmm.
in one way, it's very impressive how they were able to pull off this, world event. Not one person on the planet probably, they're everybody's privy to what COVID-19 stands for or so, they've tied it to something. So I think, we've had a divide in the world
Yep.
and we're in this world but but we're certainly not of it and I just try to live in this space on this planet where I can be my best, do my best, create, as much as I possibly can because creation is the solution out of the matrix,
Yep.
not be a slave to the system. So I'm super passionate about healthcare reform. I think people don't even need a healthcare system once they have all the right information and we can empower them with, healthy solutions where they actually don't need, a doctor per se. And it really just starts with, eliminating a lot of the things that we put in our body. For example, vaccines. If you stop putting vaccines in your body, you're going to be way more healthier. It's just a fact, and then all these big pharma medications, everything from blood pressure meds, cholesterol pills, antidepressants, sleeping pills. I mean, we need to transition to a way healthier solution and stop, beating our bodies up based on, health and safety or,
Yep.
so people have to take their power back. It's just so, frustrating to see people so compliant, and they've given away their sovereignty essentially. So I think a lot of people are wanting that back, and that's good. It's going to be a fight, but it's a good fight to fight.
I think the biggest problem, I think the easiest way I've noticed like what is wrong with any sort of healthcare, everyone's got their own version of big pharma who just want to sell this, sell that, and you buy this and buy that. But the biggest thing for me where I've actually looked at it recently and gone like, this actually shows everybody exactly what the healthcare system is these fat loss jabs. Right. So it's like people don't want to exercise. They don't want to do this. They'd rather take an injection. And it's the same with any of your health, whether it's, your mental health or anything like that. It's like there's natural ways of recovering from these things as well. So like, if even if you just want to talk about anxiety, depression, these sorts of things, I do understand there can be a chemical imbalance in the brain for these things, and there are certain disorders. But most of the time, people are going to the doctors and they're like, "Yeah, I just feel a little bit down or whatnot," and the doctors are like, "Here's a tablet." Why wouldn't just suggest to them try going out and get some fresh air, try eating some fruit and vegetables, you know, work out, release endorphins, do good things. Because eating junk food, sitting watching TV all day, looking at Instagram at all the girls on Love Island who are really good looking and you don't feel good looking, so you're feeling crap about that. But no, here's a tablet. It's, it's crazy.
You know, most physicians, that's just their go-to because they've
Hmm.
been trained on that platform. So you know, it's like going, you know, to a platform knowing that you're gonna be, most likely given something in return that's gonna harm you more than help you. So I call it medical system induced trauma. So, for example, somebody maybe has a traumatic episode. For example, I don't know if you guys heard here in England, but there was, in Minneapolis, Minnesota, there was that shooting at a Catholic church
Yes,
where
yes.
where 2 children died, and then 18 were injured. So I actually went down to the Catholic church because I happened to be in the city the same
Oh,
time that it
wow.
happened. So I went there and I did a live, and I thought, you know what, like, how many people are going to be forever traumatized by that event?
Oh,
So
yeah.
many people, right? So what are they gonna do? Like, their bodies are gonna start to shut down because, this energy, this such negative energy around trauma, it just, like, it steals your life force, right?
Yep.
So a lot of people, not able to sleep because of the event, depressed because of the event, and they go to their family doctor to get help. Genuinely, they just need to sleep. They need to not feel depressed. But these medications that they're being prescribed are the side effects are so nasty, including, suicidal ideation. And we see
Yeah.
a lot of people committing suicide within 6 weeks of starting an antidepressant. It actually says right there on the
Yeah.
insert, will cause suicidal ideation. So we're normalizing this. How is this possible? So I went down there to ground zero and I said, you know what? Instead of taking a traditional sleeping pill
Yep.
or antidepressant, why don't we switch to, a more organic, healthy, non-addictive thing like cannabis? Okay. There's great research for using cannabis in cancer, for sleeping, for mood adjustments, the medicinal cannabis that doesn't cause these suicide ideation. So
Yeah.
we just need to make a whole shift, not only in the vaccine issue, and obviously that's how I was born into this career, but it was a starting place, and we have to say, "Okay, what else is there out there that's causing us harm that we don't even need to do?" For example, secondary screening, you know, um, uh, breast mammograms, for example. You
Mhm.
don't need to do a mammogram, okay? It actually causes more harm than good. Prostate exams, you actually don't need to do prostate exams. Routine blood screening, you actually don't need to do that. It's all a catalyst for the medical mafia to get in there, create a problem. They love searching for cancer. Okay, this is the real epidemic right now. People who've been diagnosed with cancer, and they often get, a diagnosis that's not even, what's the word, true. It's a
Right.
misdiagnosis, or it's they do a biopsy, for example, and then it causes the malignancy. So we have really been focusing on the cancer healing space in the last couple of years, only because that's what showed up for us nurses to help people with. So we believe that cancer is a parasite infection. And that's why, for example, things like ivermectin and mebendazole are working so well because it's killing the parasites in the body. The parasites are creating these sacs, which we
Yep.
call tumors, okay?
Yep.
So this is what cancer really is. When we examined the vaccines in 2022, we got our hands on a bunch of vaccines. I actually broke or helped myself into a vaccine clinic at 3 a.m. one evening. I grabbed a whole bunch of vaccines. I gave it to my doctor friend, Dr. Nagasi. He evaluated it under high powered microscope lab at a university. We actually found things that looked like a parasite.
Wow.
It's moving, it had tentacles. Like, why is this thing in vaccines? And the reason why I did that is because I was seeing so many people getting hurt from this one vaccine. And I thought, I need to somehow find out what's in here because this is
Yep.
not normal. I've seen other vaccines being administered and people were not responding, you know, like devastating to these other ones. So why is the COVID-19 vaccine different? And this was part of our findings. We just noted it at the time, but fast forward a couple of years later, why are so many people who got the COVID-19 vaccine struggling with turbo cancer? Well, we think it's because there were parasites in the vaccine that were infected into the human body. And this is what cancer is. And that's why ivermectin was banned in 2020 because
Yeah.
they knew it was actually going to help people. So not only did they cause this problem, but then they took away the solution to help with the problem. So these are like These are murderers.
Yeah,
These
yeah.
This scum of the earth, this is people who don't mind harming a child. So we're dealing with some pretty sick minds, in my opinion. And that's why we cannot negotiate our way out of this. We just have to go straight to the solution, straight to our findings, and straight to helping people and leaving everything else on the peripheral. So that's my rant about cancer, and we're seeing really great success. Have you heard of ivermectin before, Josh?
I have, yeah, only through Joe Rogan though. I'll be honest. I've only heard it through the Joe Rogan podcast.
Well, I mean,
It's
Joe's pretty honest. He's an honest,
yeah.
what comes out. And ivermectin, it's an antiparasitic. It kills parasites. It kills worms. That's all it does.
Oh
Okay.
yeah, the horse dewormer. Yeah, that's all it is, right?
The horse dewormer. That's right. I
Yeah.
say if it's good enough for your horse, it's good enough for you. So, a lot of the farmers, they deworm their animals and they have it on their farm anyways. So, Um, but it came on scene, it really helped people with the COVID-19 bioweapon. It helps with neuropathy. It helps, decrease a parasitic load. Um, and we're finding people too, we help people with cancer who never had the vaccine either.
Oh
So
wow. Okay.
this is another interesting one. Has cancer always been a parasitic infection, whether you had the vaccine or not? And it's kind of looking that way because there's parasites in the food we eat, in the water we drink. Um, so there's not only that's not the only way people have gotten parasites is through the vaccine. It is through other ways. But what is cancer anyways? Like we were born into this cancer campaign, right, Josh? And it was like
Hmm.
cancer research and oh, you don't want to get a devastating diagnosis of cancer because you're going to be you're going to be dead in 3 to 6 months. These doctors are literally giving people timelines on their life. um so if we can address cancer, and these are a couple of the ways that we do it. We say eliminate all sugar and carbohydrates. Sugar and carbohydrates is not a cancer's friend. Or
Yeah.
actually,
Yeah.
they love each other. Actually, they're
Yeah.
love.
Yeah. Yeah.
So break them up, okay? Take away the carbohydrates and the sugar for the cancer. Literally starve the cancer out, okay?
And
That
that's sorry to interrupt, but I've heard like people who do like super water fasting, like that I've heard a lot about if you just do like a water fast for like, you know, days like, up to like 4 days or whatnot, that can actually be a very like positive reaction to like cancers and things like that. Is that something you see or you agree with?
recommend fasting for sure. There's actually fasting clinics in Europe. People will go there for 40 days
Oh
with a
wow.
cancer diagnosis, fast with facilitated support, and literally come out clean bill of health. Okay.
That's crazy. That is crazy.
Let food be thy medicine. Okay. Food is just so important. We underestimate the importance of food. I mean, there are so many poisons in our food if we're not paying attention. For example, glyphosates. Glyphosates is a pesticide. Okay. It kills weeds, but it's in
Hmm.
our food and it's causing so many gut issues, including the cancers. So we really have to be mindful, even if we're thinking we're eating organic. I mean,
Yeah.
we're just trusting whoever's saying this is organic? Like, we have to really dig deep where our food is coming from and
and
not.
and that's where you also have to worry about where you're getting your like vegetables and what from as well, because then you can look at like the Monsanto industry where they're spraying certain plants with certain um
Yeah.
additives to make them bigger and all this sort of stuff. They're engineering their plants essentially, so you've got also it's so, I suppose. But a question would be how would you go about doing that though, like with regards to cutting out carbs and sugars? I'm assuming natural sugars are okay, right?
Well,
Like
if we're gonna
strawberries
get
and
really serious, if you're a cancer patient, if you're
Mhm.
a person with, a cancer diagnosis, you're pretty scared, and you're gonna do whatever it takes to get rid of your cancer, okay? This
Yeah.
is my observation. So if you're serious about your health, if you're serious about eliminating the cancer, you're gonna stop carbohydrates and sugars. I mean, some berries are okay, blueberries and strawberries, but for the most part, all these refined, anything starchy, sugar is sugar. Okay, whether it's watermelon,
Yeah.
your body's watermelon or like licorice, for example, your body's still interpreting that as sugar, and the parasites are still like, enjoying it. So, or we say cut out all carbohydrates and sugars, go on a keto, go on a Mediterranean, eat a lot of, meat products. Red
Yeah,
meat is great. So, it's working for people. So, change your diet, introduce antiparasitics, ivermectin, mebendazole, which by the way, we do have a shipping department in England. So if anybody from the UK wants to order products, it's shipped from England, okay? And you're not gonna have to deal with a lot of these border issues, and it comes to you fast. So that's on our EzraHealing.com and our UK site. We can get into that in a bit, but we have nurses on staff ready to do patient wellness consultations. These are very experienced, seasoned nurses who were terminated because they didn't take the vaccine.
that's still
So,
crazy to me.
there were 4,000 nurses in October of 2021 just in my province alone that got terminated.
And
Probably.
how did that happen? So like let's what was like your experience in that situation? Like obviously you've rejected the vaccine. What was it that happened? How did it all go about that you were just like, yep, and they were like basically bye bye.
Yeah, the health authority gave us 3 weeks pretty much to decide. Um, And if we hadn't been vaccinated at a specific date, I think it was October 26, 2021, if we weren't vaccinated and showing proof at that time, then we were asked to leave our workspace. And
That's
that's what happened to
crazy.
me. Like, I mean, this is a doctor's clinic that I worked in for 7 years, okay?
Yeah. Yeah.
This is my family, okay, my work family, and, the whole health authority, if you're not vaccinated by this date, you can't come to work and you're fired. So, I literally, the staff, turned on me, like, they didn't even say bye to me, they locked the door on me, they changed the locks, I moved out my stuff, and that was it, just ghosted, "Bye-bye," um
Wow.
because I wasn't conforming, wasn't complying, I wasn't able to exercise my own rights, my body, my
Hmm.
choice. Um, I mean, in hindsight, Josh, it was the best thing that ever happened to
Yeah,
healthcare
of course.
in
Of
the
course.
world, and this change needed to happen because a life lived on a lie is no life at all. You cannot become healthy on a platform that's full of deception and
Yeah.
criminal activity. So, a lot of us truthers, healthcare truthers, we've just gone right back into healthcare mode, but on the right side of history, and we're just, doing no harm. That's my motto: do no harm. And it's been really fun, disease prevention, health promotion, and eventually, hopefully, nobody will ever need a healthcare provider again because we're all our own healthcare providers.
Yeah, and with regards to like all the research that you and the team are doing and whatnot, I'm assuming that are papers being written and this sort of thing for people to read online. Is that all available or?
Yeah, so we have our protocols. We have our plans. So the intake usually it's a 3-month process. So if
Hmm.
you're interested, you would go to our website, EzraHealing.com. You would book a consultation. There's different sorts of consultations, chronic disease, medication management, well baby exams. We're offering now free well baby exams, which is exciting because we want to talk to all the parents 0 to 12 months or age, and educate them about the harms of vaccines. So you would
Yeah.
book a consultation, and then you're going to get a phone call by one of our nurses, and then a Zoom call, and then we have an electronic health record that we're going to be charting your notes in. I'm going to have access to it, and the client will have access to it. So we've raised the bar pretty high, for what feels like the old system, but it's new and refreshed
Yeah.
because the nurses know what the old system is all about, what the backbone of is, and I think we're the best ones to create something new. So it's just an intake, contacting us. You can either, if you have questions, we have an email, we have a phone number, we have a Wix live chat group. Ask all the questions that you want. Book a wellness consultation with the nurse. We have an online store. ivermectin, mebendazole, vitamin D. Those are our top kind of 3 selling products. I recommend everybody do a parasite detox, whether they've
Hmm.
had the vaccine or not, at least, if you're around pets or if you do some traveling once every 6 months. If you have cancer, we'd love to talk with you. This is our specialty. This is our wheelhouse. We'll work with, your current plan that you're doing right now. We can modify it. We can replace it. If you want to keep doing chemo and radiation, we'll definitely support you. But we don't recommend it, but we'll definitely support you, whatever you decide. We'll work with your current family doctor if you want. We're getting the referrals now from inside the medical matrix.
Oh,
The
wow.
doctors now are referring to Ezra Healing, which is
That's a
really
big
nice.
step.
It's a big, big step, and
Mm.
it's really nice to see, because there are some weak doctors inside the system, and I guess we need them there too.
100%, 100%. And with regards to like the Ezra healing things and everything that you've spoken about regarding like the ivermectin and the no sugars, no carbs, and everything that you would use to the word treat, is that's the correct way to say it, right? To treat
Yeah,
somebody?
sure.
Um, where where is now to put a skepticism hat on for a second? What do you have like a log of proof as per se? Like, is there anything that people can go, this is a scientific read, or this is something I can look at and go, does that make sense?
Yeah, we work with, different doctors. My probably go-to doctor is Dr. William Mackis out of Alberta, Canada. He's an oncologist himself. So he's written a lot of science-based papers,
Okay.
and we have those papers available to people if they want to see the science backed behind ivermectin and our style of doing things. But I think, Josh, to be honest, the biggest impact, the best research papers are the walking testimonies of people
100%.
who have actually been healed. Their stories are so powerful. We've been working with people for 6 to 12 months now. Some of them, have completely recovered. Actually, a lot of them have completely recovered. They're feeling better. They go back to their oncologist maybe for a CT scan. Their tumors have shrunk.
Wow.
Um, so the proof is in the pudding. You can't argue
Yeah.
with the numbers. You can't argue with a client who's gone through your protocol and program and say, "This has worked for me, and I recommend my family member or friend." So I think referrals are our strongest point, and I'm super happy about that. Because that's the purest form of truth in my
Yeah.
mind. It's not tainted by, big pharma or a university or big money. It's just the client. It's just a human experience, and they're sharing it. And to me, that's, a lot of the research that I share and that I need and other people need too.
So why? Because obviously, I'm sat here thinking this is, excuse my French, but fucking phenomenal, right? I'm sat here like, why is this not on TV? Why has not everybody heard about this? What do you think the reason is? Like, why do you have to shout so loud for people to know about what you're doing? Is it just big pharma because a pills are money, this is money, and it's a money driven industry? What is it in your opinion that, because I think that's what I think. I think big pharma just want to basically, again, these people, big pharma and all this, they really stress me out. So you will have to excuse the way I talk, but I really do think they just don't give a shit about anybody, and everything they do is for the paper in their pocket. And it's like they just don't care.
Oh, so you know what the real virus is, Josh?
People.
Media. Media
Okay, yeah,
is the real virus.
it's the
Uh,
poison. That's what I
I
say to my granddad.
just think that we're in this, like, movie set, and, you know, all these actors and actresses are, on the media, the news channels. There's a lot of fake news out there. So they've been able to dominate, and this was all part of their strategizing. They were able to dominate the media, and this is where they shut out the propaganda, and they bury little people like me with a big voice.
Yeah.
uh, and then this is where, your podcast is born, because you're just like, I need to get out the truth. I need to start a platform where people can come and speak the truth. So like you're replacing, this tyrannical media and all these
Mhm.
podcasters are. So, we're maybe not on mainstream television and commercials yet,
That's
but it's
dying anyway.
it's coming. It really
Yeah.
we're gonna be mainstream at some point, and I think we're the anchors of truth, because when we have all these people really finally start to wake up, they're gonna need somewhere to go. They're gonna need somewhere to anchor into. Ezra
Yeah.
He or, Josh in England, or whoever has spoken truth and really not been afraid to share it. So, um I this is why people are not, I think, waking up faster than we'd like them to, because it's not on our news channels yet,
Y
and so
yeah. I think that, people are waking up way more than they would have before the vaccine, whatever you wanna call it, the jags, as people call them over here. They don't call them jabs, they call them jags. Um, I think people are waking up a lot more since COVID. So I think they've actually shot themselves in the foot massively. And it's specifically like the biggest thing is, and I know everybody who's ever listened to podcasts has probably heard this on the Joe Rogan podcast anyway, but where they've put him on TV and they've changed it a yellow tinge to make him look ill and all this. And he's got the biggest platform in the world. And he's come out and been like, what the fuck? Like, what are they doing? And so many people listen to that and have gone, oh shit, yeah. Like the zeitgeist is changing. Like the curtain has lifted. Um, and mainstream media, I call mainstream media to my granddad. I call it the poison. So if I walk in his house and he's watching like BBC News or whatever, I'm like, oh, turn that poison off. Why would you want to
yeah,
feel negative all day? Um, but that's changing. You've got like citizen journalism and social media presences, which are like most people go to X for their news now. It's the most used platform for news, which is brilliant. It is a cesspit in some ways, but it is brilliant. um, so I think that's like really, really positive, and I do think they definitely shot themselves in the foot. What is when we talk about like the big pharma, all this sort of thing, what do you think their like plan is? Do you think it's just money or
I think it's way more than money, way more, which is even more
scarier?
more unnerving. They have enough money. They have lots of money.
Hmm.
I think I think they wanna steal our energetic life force. I think we are a being that, you know, we're so powerful. We don't even know
Yeah.
how powerful we are, but they know how powerful we are. So they wanna steal our energy, our life force. Like, they just wanna harvest it.
Hmm.
I think they get a high off of that, they get a kick off of that. This is not just money, because what is money? Like, what's our currency system even?
Yeah.
It's
True.
just it I guess it's just mass manipulation. They do have a specific agenda. I've also, went to the other side, and I thought, "Is all of this happening for us? Just to
Hmm.
wake us up? Just to say, 'Stop being so complacent, human beings,' and, start really living, start really creating heaven on earth." And, or beauty from ashes, that's where we're
Yeah.
at.
Yeah.
We had to burn it down because we saw the corruption. So that, as you said, the medical system in your country is crumbling. It's
Yeah.
crumbling here too in Canada. It's crumbling in the States. So, these are like empires. The empire is falling, but it takes, a while for an empire to fall. It's only a matter of time where, we will be so, we will dominate. And I know there's not, we look like there's not enough of us, but the resonance that we're giving off, Josh, is so powerful. And that's what they want. They want our resonance. They want our frequency. They want our vibration. They want our energy. They want our life force. And it's people like you and me who said, no, 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 you're not going to have
Hmm.
this. This is mine. I'm not selling my soul. Thanks for offering, but I'm not selling my soul in this lifetime. Um, and that is like so powerful. And that's what I really hope people, when at Ezra Healing, this is what we want people to know. It's not even about your diagnosis or ivermectin or keto. It's like, where is your soul? What is your primal instinct telling you?
Yeah.
And grab onto that, use it. It's there as a gift to you. That literally is God speaking to you. So, stop relying on the news. Stop
Yeah.
relying on podcasts. Start
Except
relying,
from this one.
except for Josh's. Um, you know, just disregard Joe Rogan even, right? So just go straight to Josh. Um, so like, let's just, like, get this, let's just get back what was stolen from us. And I talked to a lot of people who did take the vaccine, and not one person is glad they took it. I call it vaccine regret syndrome. People are upset that they were cornered and they took it, to keep their job, to see a family member, to get on a plane, whatever the reason was. But I also say you actually weren't forced. You actually chose it.
Yeah.
Well, nobody, like, tied you down with handcuffs and, like, stabbed you in the arm while you're squirming on the ground, okay?
Mhm.
Everybody sat down and rolled up their sleeve. So that is compliance, that's an agreement. Yes,
Yeah.
I know, you could have lost your job and all this stuff, but at the end of the day, you chose that. So the
Yeah.
good news about that is you can choose something else now. See, look at the power of your choice. So it's just literally perspective. It's cleaning up our pineal gland. Pineal
Yeah.
gland is a great little organ in our brain responsible for the magic in your life, but it's been calcified by the vaccines, the food we eat, the fluoride in the toothpaste and the water, not getting enough sunshine, looking at the morning sun is really healthy. It cleans out your pineal gland so you can think properly again. So, that's part of our protocols when somebody has cancer or vaccine injury, morning sunshine. Look at the
Yeah.
sun.
Yeah, no, do you know what? It's so funny. I speak to so many people who deal in different things. I'll speak to people who just believe, just want to talk about, like, your energy levels. I'll speak to people who just want to talk about microplastics and all of these things, and everybody says the same thing, which is crazy, and that shows a massive alignment to me. Anyway, you've got people who are going into the rainforest with a shaman, and all they want to do is clear their pineal gland. They want to do this. They want to be healthy and all of these things. But everyone aligns. We're all talking about the same thing. And it has been said on this podcast before by me, actually, that anything you watch on TV is just trying to dumb you down to a level because you don't know how special you are as a person, which is exactly what you just said. And it
Yeah.
shows a massive alignment. And I do think there's way more people waking up than anybody can imagine. It's just people are scared to say it, like you say about losing their job. I do have to openly admit on here, though, I did take the jab to go on holiday. Um, and I wasn't pinned down as such, but I think my fiance would have pinned me down if she didn't go on that holiday. So I was scared for my life. I shouldn't make a joke out of it. But what I did find is, I'd love to know your opinion on this. Since getting the vaccine, I get the flu like you would not believe every 3 to 6 months. And it's funny now. And I'd like to touch on that in a second. But the craziest thing about how I believe, like, the general population are waking up is when my boss rings me for what we call a return to work. It's like, um, if you've been off sick, you have to fill out a form why you were sick, what can we do to improve your situation and whatnot. And they literally wrote on the form, Josh gets ill since having the COVID vaccine. And I was like, fucking A.
Mhm. Yeah, please send me that document.
Yeah, if I can find it, I definitely would. But
Well,
it's
I can definitely comment on that, Josh. Your immune system was attacked
mhm,
major. So when you are exposed to something, it's having a hard time, fighting it off. So I would definitely put you on the vaccine injury protocol, and strengthen up your immune system.
mhm,
Uh, so what happens in a vaccine injury is our main organ that's affected are our red blood cells. Okay, our blood is an organ in itself. So it attacks the red blood cells and makes the cells sticky, like they clump together. Okay. And why is this bad? Well, red blood cells, their main job is to, help carry the oxygen molecule. But when
mhm,
you have sticky red blood cells, that oxygen molecule cannot cross and go back and forth to each other. Okay. So you're lacking oxygen, which affects every organ that you have. So let's unstick your red blood cells, which is what ivermectin does. Let's boost up your immune system. You should be taking at least 20 to 60,000 of international units of vitamin D a day. I'm sure you're not getting the sunlight that you need,
Not in
especially
England.
especially now we're coming into, another winter. So vitamin D is so important.
Hmm.
Again, vitamin D is attacked. The medical mafia attacks vitamin D. Why? Because it actually boosts your immune system and it's super easy. It's inexpensive. The best source is the sunshine, but when you can't, you take a supplement. So, you're going to be taking high doses of vitamin D um, all the time,
Hmm.
until you're not getting sick every 3 to 6 months.
I can't wait to send that recording part to my boss and be like, "Told you so." um, yeah, no, I do believe it's affected my immune system for sure. I mean, I don't get sick in other ways. Yeah, maybe I will. So would you like, even for somebody who, I make it sound like it's a small feat, but even for somebody who's just getting a cold a bit more now, or just getting the flu a bit more, would you recommend a course of ivermectin as well as the vitamin D and whatnot?
Yeah. So, like, I would do like a prophylactic prevention. So I would do a 1 week dose of ivermectin, just always. Okay. Just always do one dose a week of ivermectin. And then you're strengthening your immune system. So when you are exposed, hopefully you're not going to come down with anything severe. But if you start to feel like, okay, I'm getting sick, we're going to load you up with ivermectin. And we usually dose it based on your body weight. So that's why it's important to talk to a nurse, but we also include, dosing charts. So yeah, just start on your ivermectin, high doses of vitamin D, vitamin C, eliminate carbohydrates and sugar, when you're sick, that those aren't helping you.
Yep, yep.
So, yeah, to answer your question.
Okay. And again, with that, what about if somebody like doesn't? You may have already said this, but I just want to confirm it. Let's say someone's had the vaccine, they feel no sense of vaccine injured, they feel no sense of anything, they feel the same as before the vaccine. Would you recommend ivermectin to somebody like that as well, just because they've had it?
Those are actually the people that I wanna see the most because this is where we get to be preventative. Why
Yes. Yeah.
why wait for a diagnosis of cancer? Like, why? Why are we gonna do that? We know the vaccine, increases your chance of getting cancer substantially. We know that now. So just do a prophylactic approach to help prevent you from getting cancer. That's what I would say. Um, you know, uh People often are not putting the 2 and 2 together that, maybe the reason why they're not feeling well or this symptom popped up is because they got the vaccine, maybe it was, like, 4 years ago.
Yep.
They can't remember because the last 4 years, 5 years has been an utter shit show, and people's brains,
They're
so
fried.
yeah, they're fried and they're just a lot of people are in survival mode. So, if you did take the vaccine, be proactive. You have something that's harming your body. So let's try get it out. Let's repair your body.
Yeah. No, of course. And so you were talking about the red blood cells clumping together and whatnot. Um, Would that would that not lead to an increasing of, is it anemia? Would that lead to things like that as well? Because that isn't that something to do with your blood cells not having a high enough count and whatnot?
It doesn't destroy from what we're seeing, it doesn't destroy the red blood cell. You still have them floating around, but they're not carrying enough oxygen. So,
Okay.
um, you know, uh
The only reason I say that is I hear that word a lot more now. Anemic. I hear that word so much more.
Yeah, so and I think what's being interpreted is they're just labeling it. People need to label something, so they're gonna use the word anemia,
Hmm.
um, low red blood cell count, but it's just a lack of oxygen on your red blood cells. So it's not like you've lost blood, you're not bleeding out.
Yeah. Yeah.
It's just the chemistry of your red blood cells, they're not optimal anymore. So and
Okay.
we can see that on a live blood cell analysis. So it's basically you have like a little finger poke, you put it on a slide, and then you look at it under a microscope on a big
Okay.
screen. And you can see your live red blood cells in live time, what they're doing. Are they sticking together? Are they not well? And this is a great diagnostic tool, which we have in our Ezra Healing clinics. I would love to open up a clinic in London, England. When I was there a couple years ago, I thought I really like this place. I love the people there.
Oh, it's
So,
shit now.
so, so maybe Josh, you and I can coordinate opening up a clinic together.
Hey, well, I'll be here for anything, me. Um, so there's a gentleman in the UK. He works in a mortuary. Okay, he's a no, he does what am I saying? Well, mortuary. He does post
Autopsy?
autopsy. That's the one. He does autopsies. And he's also a funeral director. So he has a funeral home. He'll do these bits and bobs. And he's noticed since the COVID vaccine that, and I see them on a podcast, and he brought live like white tree
Mhm.
branch looking blood clots from people, and like it's crazy because these are people who, have had the vaccine, and then, they have to get a leg amputated, or they're dying, and they're not dying because of these blood clots, but he's actually then doing these autopsies and seeing, all of these crazy blood clots in everywhere.
So those are actually, from my understanding, not blood clots. They're not blood.
Hmm.
They're like a fibrinogen, right? You said white, right?
Yes.
But
Yeah.
blood clot is full on red throughout. Okay,
Okay.
I've seen blood clots; they're not white at all. So, what are these white things that the coroners are pulling out of people vaccinated? The died suddenly ones. Are they parasites? Are
Hmm.
those parasites? They could be.
Could be. Yeah.
Are they fibrinogen? Could there have been some sort of, you know, pa particle that didn't break down in the vaccine, and then we have, like, almost like scar tissue forming around it? Like, what are these white big strands pulling out? It leads me to believe that these are parasitic in nature, truly, because
Yeah.
when people go on a parasite detox on our protocol, on our ivermectin, often people will be, eliminating parasites from their body, from their stool, from their
Hmm.
skin. I've even seen out of their eyeballs, in their mouth. So, the parasites need to get out somehow, and, back to these long white strands, could these be parasites, and then they're floating around in the body, and then they get lodged somewhere, and then the
Yeah.
blood flow can't get around, okay? That's where you have a stroke. That's where you have a heart attack. That's where you're having no blood flow to your lower legs, and then the amputation needs to happen. So,
Right.
um I find that the ivermectin breaks down these white clots because
Okay.
it's most likely a parasitic infection in nature.
Wow.
And that's
That's
what that's what these cancers are. They're like
Yeah.
balls of paras. They're just a you know, but our body also, when it has garbage floating around in it, it'll collect it and it'll make a capsule. Okay,
Yeah.
that's
Yeah.
that's how smart our body is. And then when doctors say, "Oh, well, we need to do a biopsy of this tumor," and they go in with something sharp and they poke it, well, now you have the sac that's open and all these like cells, parasites are floating through the rest of your body and they're going to plant somewhere else.
Yeah. Yeah.
Maybe your lungs, maybe your brain. And this is where you have malignancy happen.
It's essentially pollinating. They're essentially pollinating around your body, which is yeah. And what I will say to people listening as well, like the person who's gone on these podcasts and these shows speaking about these clots, a lot of these clots are coming from people who have died in a car accident. So he's not going looking for these things. It's not like he's some conspiracy theorist who's like, I need to search for these white clots. It's someone's had a car accident. He's doing this bit and gone, what the fuck is this? And that's the most shocking part about it. And do
And why are people having these car accidents? Are they having sudden strokes so they can't drive anymore? They drive off the road and it's
Mhm.
like, "Oh, they were in a car accident, but, like, what happened at the wheel?"
Yeah, I mean, the thing with that though is I do believe if that happened, they'd still somehow try and put it down to like a fucking COVID death. And the reason I say that is here's a very personal story for me, and I'll tell you how it's still people listening. It's still fucking bad out there. My nan, she passed away at the end of last year. R.I.P. God rest her soul. Um, she had a bad chest, COPD. Okay. Now, the woman, bless her soul, she weighed like 43 kilos. She was yay big. She was a tiny old lady. She was late 70s, early 80s. And she went into hospital with chest pains on the Friday. On the Saturday, I went to visit her. Absolutely fine. Perfectly fine. On the Sunday, I get a phone call from the nurse. Josh, you need to come in and say goodbye to your nan. Okay, right. Why? I come in, I've got to wear a mask, I've got to wear a suit, I've got to wear a hat, and now she's got COVID and passed away of COVID within a day.
Mhm,
Fuck no. Fuck no.
mhm.
There's some bullshit, right? They're still labeling it. They're still doing this.
You know, it's so sad how many, elderly people died alone in a care
Hmm.
facility. Their family members couldn't get to them. This is probably one of the biggest crimes of humanity that we'll ever see, dying alone,
Missing
uh,
your birth of your child.
missing the birth of your child. I mean, these are unforgivable things.
Hmm.
Like, this is not this ends here with you and me and the rest of the people who are, making we will never accept this.
Yeah.
We will always keep these stories alive. They need to be told. Stories are very powerful. Um, and this will never be acceptable. Um, and people have been so devastated for not being maybe present with their family member or just how it was handled.
Hmm.
um, so many premature deaths because of the shot. So, it's really important work that we're doing, and we have to, keep on it, and there's no stopping, what's coming, and the truth is coming out so hot and heavy. I mean, look at Josh, look how far we've come in just 4 years.
Yeah.
We went from being, vilified, eliminated, shamed, called crazy to totally legitimized and running, full on organizations based out of that. So, I mean, what's another 4 years gonna bring, right? You're gonna be the Joe
Yeah.
of the UK, and I'm super excited for you to be that.
Maybe
Um,
one day.
that
No,
is
I do.
call it in.
I do my best. That's all I'll say. And the only reason I say that story to people is because the first thing I did is I went to those nurses and I was like, "That's fuck." I straight went to them and I was like, "That's bullshit. You're lying." And do not be scared to like. You don't have to do it in a horrible way. Listen, I was going for it. It was a traumatic day for me, so I could have said it in a better way. I'm not going to lie, but question these things. The more people who question these things, the more people are going to open up. And with that being said, as well, what would you say to a nurse now who's still in the NHS, big pharma, and anything like that, if you could say something to them, if they were listening and they were like, "Oh, what the fuck is all this?" and you could turn around and be like, "No," what would you actually say to them?
Hmm. There's a wide variety of spectrums of personalities still in the medical matrix. The more that I talk to them, the more that I'm learning they really, really didn't want to. They did it
Yeah,
obviously to keep their job. We're now collaborating with nurses inside the system who are motivated to make a change. We want to be, providing employment opportunities for these nurses to come over to the right side of history and truly deliver, do no harm healthcare. I would say to that nurse is, anything is possible. Live the life that will be happy with. Is this why you went into nursing? To, be controlled, to take, things in your bodies that you don't want? Is this really healthcare? And the answer will I know what the answer will be. So I'm disappointed more nurses didn't leave the system. I was hoping the system would literally just crumble from the inside, and it
yeah,
is slowly, but I was hoping for more of this, like, mass exodus by specifically the nurses. Because if the nurses had all stood up and we said no, literally healthcare would stop, because who
yeah,
runs these shows? It's the nurses, because we're the
yeah,
bodies that are moving around, right? So, my goal is to employ all the nurses who ever want to come out of that system, all the nurses who got fired for not taking the vaccine. I love nurses. I think that they're worth their weight in gold. Um, and there's a lot of nurses struggling, I think, with the moral and ethical decisions and what they're seeing, in their workplaces. And It's up to them to make the change, and we we take the leap of faith, and literally God is just orchestrating our every move. So put this faith into action.
Yeah, no, I agree. I feel for the nurses here, to be honest with you. I mean, we were doing this stupid shit where on a Thursday night, everyone was outside of their door with a pot and pan. Thank you, NHS, all this. They don't give a shit. Look, at the end of the day, the best way I would put it is genuinely people like yourself and anyone working in the medical industry all deserve a thank you. But it is a shame more didn't stand up 100%. But you can still appreciate they're busy, especially over here. Their pay is so crap. They are like one of the lowest paid jobs over here, which is it's criminal. It really is criminal. What would you say to people who are like, oh, conspiracy theory, all this sort of stuff?
I haven't been wrong yet.
Solid.
I haven't been wrong yet. Not one thing have I been wrong on. So, I've had smear campaigns. I always seem to have some active smear campaign going on about me somewhere in the world. And I've learned to just roll with it and ignore it.
I'm not
Um,
that big yet. Maybe
you
one
know,
day.
Because there are I mean, why would they not try stop us, really, if you think
Yeah,
about it? I mean, we're targets, but I know what I know, and you can't negotiate with the truth. It's just gonna be there, so I support the truth. And, they can call me names, they can call me whatever, but I know what I know, and that's all I need to know.
yeah, nah, 100%. I think that's perfect as well because, like you said, you haven't been wrong yet. That's it. It's that easy.
Have I been wrong? Prove
No,
prove me wrong. Please
you,
prove me wrong.
yeah, do your best, do your best. And obviously through this whole like journey that you've had, how has it made you think about like truth and freedom? Do you just believe it's not a thing anymore? What is truth and freedom to you?
I love truth. I love freedom. Those are the 2 things I really pursue hard in my life. I'm always curious. I'm always investigating,
Yeah,
everything in my world. I think we have to have this childlike mind again, and let's ask, "Why? Why this?" You know? Um, it's just been an honor to stand next to the truth, and
yeah,
the truth has set me free. And that is my passion, my goal is to help set other people free as well, because nobody wants to be a slave to a master, that, is not for us. I wanna be, working in a big team. I'm happy to have leadership in my life if they have the right intentions.
yeah, 100%, 100%. A lot of people do feel like their freedoms are being taken at the moment, and this is just a massive. It's an eye opener really because it's so surprising that people are still allowing Ezra Healing to be a thing. Like, if they had the amount of control they'd want, that would be shut down so fast. So that's showing a massive like upwards trend in, you know, what we're talking about today and other things that I would say are more on the fringe side of it, but it's that they can't stop it anymore. There's too many of us.
I made a vow that this is the mound I die on. If this is where I end my life, well, at least I'm doing something I love, first of
Yep.
all. And then second of all, the other thing is we need to save the children at all cost, financially, emotionally, physically. We are fighting for them on their behalf so they don't have to fight this battle. I want our kids to come into something beautiful that we've built. So, they're targeting the kids, they're murdering the kids with these jabs. And that's why I've offered free baby wellness, consultations, 0 to
Hmm.
12 months. It's free because this is our crucial, these are our crucial little people in the world. So save the kids at all cost. Just have that in your mind, and, God is literally protecting our every move.
100%. And I do, what something's just popped into my head. I need to ask this question because I did mention earlier that I had the jab and it was to go on holiday. I know. But one thing I will say is that was meant to happen because bit personal, but my child was conceived on that holiday, so it had to happen. Anyway,
Ooh.
that being said, is there anything that's come out about children who are born after having the jab? So say you have a jab and then the woman gets pregnant, 2 years later. Does it have any effects on the baby or the child at all?
I think, time will tell.
Yeah,
Um,
yeah.
if
It's early days.
she had a pregnancy, she had the delivery, you're having a child, I would definitely recommend, not to ever do any childhood vaccinations. That'll really help,
Mhm.
the situation. But, I think we saw a lot of pregnant women be jabbed, and only time will tell. We're gonna
Yeah.
see in the next probably 5 to 10 years, these children who were born because mom was vaccinated, we're gonna see, like, is there a difference? I know, like, I can point out now vaccinated children.
Oh, really?
They have they're growing this frontal lobe, it's kinda getting thicker. The space between the eyes is getting wider, and it's very apparent which children are massively vaccinated compared to a non-vaccinated child. Like, the health is so much different, the look is so much different. So, if I can leave anything with your viewers, Josh, it's if you're a parent, please stop vaccinating your child. You you never needed them. You don't need them. I know maybe you need them for daycare or for sports or for school, but this is your child's health now and forever, and it's in the power of your hands. So as a parent, please stop, please think, please don't vaccinate. If you want to have a conversation, Ezra Healing nurses are really happy to have this conversation with you.
Amazing. And I will what I will attach onto that as well is it's don't be scared of all the fear mongering that the media and everything puts in front of you. I mean, I had when we were pregnant. I don't even like when people say that. So why did I just say it? When my partner was pregnant and we had the nurse come to our house to talk about vaccines and stuff. They try to scare you so much
Mhm.
with all of these horror stories, everything else, and my stance on everything has changed recently. I would say I would never say I'm an anti-vaxxer because I'm not there yet, and I think that's fair. Everybody's on their own journey. But the older I get, the more I'm like, we don't need this vaccine, and so on. Like I'm not fully there yet, but slowly but surely. But what I will say is everybody who's listening is what you've just heard is factual and someone who's working in the industry. But my biggest thing is just stop being scared of what the media are saying. You talk about cancer earlier, like how many adverts and billboards and everything you see from the minute you are out the door all day. It's be scared of cancer, donate to cancer, cancer research, cancer this, cancer that. They want it on your mind all the time. So just don't let the fear mongering get to you, you know?
Yeah,
Um,
get back in touch with your own body, with your own intuition. It's super powerful, and it's your
yeah.
guide. It's your guide.
Okay.
Josh, I really enjoyed connecting with you. You're in a different part of the world, but I would really love to continue just to stay connected and see what we
100%.
could help people in the UK. This is what this is all about. This is how the new world is built, just by these connections right here. So I really enjoyed talking with you. You're a great guy, and thank you for
Amazing.
what you.
Amazing. And just before you go, is there anything you want to say about Ezra Healing or anything else to the listeners or
We put out a weekly newsletter, so
Yep.
if you would like to get those newsletters, go to ezrahealing.com, give us your email, take a look at our store. We do have a UK store, okay? And we would love to connect with anybody in the UK that would like more of our services. So maybe your healthcare provider, you just want to ask us questions. Maybe you want to start an Ezra Healing clinic somewhere. We really want to be in the UK. It's those are you're our people too, right? So let's
We
just
try to
continue to
be?
collaborate and plant these seeds of hope and healing, and we're gonna be fine.
That is it. That is it. And listen, I thank everybody for listening to this episode. As always, if you are listening, please do me the biggest favor because messages like this need to be shared. So, like, comment, share, subscribe, do all the good stuff. Put it in a WhatsApp group with your nan, your dog, your gecko, whatever you want it to. Just share it to everybody. Anyone who can listen, share this stuff because the message is so, so important that you, I genuinely believe everybody should be listening to conversations like this, whether you take it on board, act on it, or you just take a bit of knowledge, or you disagree. Just listen because minds can be changed and things can be actioned. And I will end this as I always end it. Please, 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 if you see somebody on the street and you say, "How are you?" just mean it, because you never know what their day is going through and you could save that person's life. Thanks for
Love that.
listening. Love you all. Peace.